Hi, everyone, and welcome to this edition of Wellness Wednesday. Today, we have a very special guest who I'd love to introduce themselves. So, Dr. Catlin, can you introduce yourself to the viewers?
Good morning. I'm Sharia Catlin. I'm a doctor of nursing practice with the Mobile County Health Department, Family Health. My clinic is located on Dauphin Island Parkway in Mobile, Alabama. Thank you for having me.
Yes, absolutely. So, one reason why we wanted Dr. Catlin to come on is to talk about a research evidence-based finding of a great health disparity among African American men aged 34 to 56. These men oftentimes are not getting their medical needs met, and there are a couple of reasons why. But we're not only talking about this demographic. This could be for really any American, because one recent finding is that 1 in 3 Americans have high blood pressure, which is the leading cause of heart disease and other life-threatening conditions. So I'd like to just kind of get into it and hear from you. I know, Dr. Catlin, you're very busy, so we just have a couple of questions for you, and we'll go from there.
Sure.
All right, great. So, Dr. Catlin, what are some signs of high blood pressure? Because that seems to be the biggest concern that we're talking about.
Well, high blood pressure is actually called the silent killer because usually there are no warning signs or symptoms. However, if present, some signs and symptoms would be blurred vision, headache, chest pain, even confusion, low back pain, upper back pain, nausea, vomiting, difficulty breathing. These are all signs and symptoms of high blood pressure if there were signs and symptoms present.
Absolutely. All right. Well, how might somebody, if they have high blood pressure, look to reduce their high blood pressure?
You could first follow a low sodium diet, and that includes eating a lot of fruits and vegetables each day.
So just being healthy.
Absolutely.
Yeah.
Another thing that could improve blood pressure is getting regular exercise and losing weight if you're overweight.
Right, absolutely. Yeah, I've definitely heard about low sodium is good. Yeah,
absolutely.
Right.
Absolutely.
And not over consuming alcohol.
Absolutely.
I read that up too of things that you noted. All right, great. What might be some misconceptions about getting your blood pressure checked and taking blood pressure medication that you might hear on a day-to-day basis in the clinic?
That poses two main points. One, the biggest misconception that I've heard of thus far is that high blood pressure is not a big deal, when it absolutely is a big deal. The second misconception is that taking blood pressure medication actually causes impotence in men. There are actually many blood pressure medications that improves impotence in men. So those two are the biggest misconceptions that I've heard thus far.
Right. And obviously people care about relationships and everything else. So I think addressing that is really important. It's just talking to your doctor about getting the right medication.
That's correct. And your doctor will be able to find the best treatment for you in your situation. But those are definitely two of the biggest misconceptions that I see in my clinic on a regular basis.
Okay. What might happen if you go on with unchecked blood pressure?
If your blood pressure is high and it remains unchecked, your blood vessels and your heart and the other organs could be damaged. And over time, that leads to heart disease and stroke, which are leading causes of death here in the U.S.
Wow. Okay. Absolutely. So how would you prepare for an accurate reading? Because you hear about them not being accurate and things of that sort. So how do you set somebody up for success if they say, all right, I'll go into the doctor. I know I need to. I hadn't been in this amount of time. But how might you prepare?
First off, what you would do is try to take your blood pressure at the same time every day. If you are taking home blood pressure measurements or going somewhere else to receive those measurements, you want to take it at the same time each day. You also want to make sure that you're not consuming alcohol or caffeine or doing rigorous exercise about an hour leading up to having that blood pressure checked. You want to make sure that you rest for about 5 minutes prior to having that blood pressure checked, and you want to remain quiet during that test as
Absolutely.
well. So those are some things that you can do to make sure that your measurement is as accurate as it can be. I didn't mention tobacco use as well. Absolutely no smoking prior to having that blood pressure check, because it can definitely interfere with the accuracy.
Absolutely. So we at Family Health are really trying to get this message out to help the people in our community because of these research statistics. So can you share with us a little bit about what we're offering here at the health department, at Family Health, and, maybe other places in the community where someone could get their blood pressure checked?
Absolutely. We here at the Mobile County Health Department definitely advocate wellness, and for that reason, we have many blood pressure stations at our satellite clinics. Here at our main health department on 251 North Bayou Street, we have kiosks where you can have your blood pressure taken, and if you have a concern or if it is an elevated reading, we have primary care providers on the premises where you are able to get appointments same day or next day to have that evaluated and further managed. If you are not in the area and you're not able to come to one of our clinics, please go to a retail pharmacy, your local CVS, Walgreens, Rite Aid. There are many charitable pharmacies like Ozanam who have blood pressure readings, blood pressure kiosk available to have your readings measured.
Okay, wonderful. Absolutely. So, in conclusion with this topic, before I might get my own blood pressure checked, just to kind of demystify the process, because that is something that prevents people from getting the help that they need, is that men out there, come on in. Making your health a priority helps you be the superhero that we all know you are.
Absolutely.
Mr. Amazing out there, we know that, you have a lot to take care of, a lot of priorities, but those preventative measures are what is the most important to keep that stamina and that ability for you to be who you want to be for your family and for your friends. So come out, and then women, if you're listening to this, which our audience, a lot of you are women, encourage the men in your life, the fathers, the husbands, whoever that is, the guy friends, to get their blood pressure checked and to go to their doctor appointments, because there's a need and you can't ignore it. So with that, what do you think about going ahead and trying this thing out?
Let's do it.
Okay.
Show you it's painless and it's... All right, so we're going to extend your arm, and I'm going to place the cuff around your upper arm.
Okay.
And I want you to relax. Yes,
Relax.
Take some good deep breaths.
Don't cross my legs, right?
Yes, keep your legs uncrossed. You didn't smoke before? Yes, very good. No caffeine, no Red Bulls, no energy drinks, just before?
Not just before. Probably about an hour ago.
Okay.
I had some caffeine, but I'm pretty sure it's been at least an hour and a half.
All right, very good.
Only 1 cup so far.
Good for you. Good for you. So we'll wait for our machine to boot, and we will proceed with our blood pressure measurement.
Okay.
And what I want you to do is just kind of relax your arm. There you go. And I promise I won't talk to you while we take our measurement. As hard as it'll be.
It's hard not being chatty sometimes.
All right. And so I'm going to press this blood pressure. In just a second. There we go. All right, so we'll remain quiet during the test. And that noise is just the cuff squeezing her arm. It is painless. No worries.
No worries.
Just a few more seconds and we will have our reading.
Okay.
And we'll see where Miss Virginia stands. 109/74. That is a wonderful blood pressure.
Good.
Her blood pressure is within normal limits.
Perfect.
And so I do appreciate your cooperation and
Absolutely.
demonstrating to our guests how easy and how painless this wonderful method of prevention is.
Absolutely. Okay, so I'm grateful that mine's not high. Now, what would be an indicator that your blood pressure is high, though? What's that measurement of going forward, moving up?
In an adult patient, hypertension is defined as having a blood pressure that is 140/90, okay? And guidelines are constantly changing. So I suspect that there will be some changes in the future as it relates to those parameters. But for now, 140/90 is definitely an indicator that you need to go in to see your primary care provider. Elevated blood pressure is anything over 120/80. So even if you have a 128/88 blood pressure, that's still elevated. That's not diagnosed hypertension, but it is elevated and still something to be concerned about and just follow up with, okay?
Absolutely. Okay. And one thing I really wanted to touch on is behavior change is really what some of this is about, that behavioral health, eating right, exercising, not drinking too much, not smoking. And although we all know we should have a better health, sometimes it's hard. Sometimes change doesn't just come overnight.
Absolutely.
So one thing that we look to do is, one, have that non-judgmental attitude. Just because you have a high blood pressure does not mean somebody's going to be shaking their finger at you.
Correct.
But connect you to resources that we offer actually here at the health department at Family Health, being behavioral health and nutrition services, among other things. We have groups like Wise Woman and things of that sort that you just go to our web, find out more, and see how you could get connected. And with that behavioral health, we know we're not going to see somebody like I as a counselor or a member of our team and say, all right, you need to do this, this, and this, check back in 3 months. That's not how the science of change works.
That's right.
You get engaged, you talk about it, you really learn about maybe some things that you didn't consider before, and then you follow up and you come back when it works for you. That might be in a week. That might be in 2 weeks. That might be in a month, but it depends on you and what you need.
Absolutely.
So it's all about relationships, and I can tell, Dr. Catlin, I really appreciate you taking the time, just like you take the time for your patients.
Oh, yeah, the pleasure is mine. The
Absolutely.
pleasure is all mine.
Wonderful.
Yes, indeed.
Okay, well, we will close there, and we hope that everybody has a great, happy Wellness Wednesday and keeping our health first. Thank you.
All right, thanks.